Welcome back to Beyond Boundaries, an Action Lab podcast. I'm Dr. Kim Baker.
And I'm Dr. Robert Hammerberg, and we're thrilled to kick off season 2, where we will be focusing on maternal and child health, a topic that touches every aspect of public health and community well-being.
This season will explore key issues like mental health, nutrition, reproductive health, emerging challenges, and the vital role of caregivers and paternal partners. We'll hear from faculty, alumni, and community leaders who are working every day to improve the health and well-being of mothers, children, and their families.
To start this season, we're laying the landscape with a deep dive into the state of maternal and child health in Texas. In this first episode, you'll hear from Dr. Eric Boerwinkle, Professor and Dean of UTHealth Houston School of Public Health. Then, for our Alumni in Action segment, Jithan, one of our amazing Action Lab fellows, and I are joined by Larianna Vernado, an experienced public health professional with Harris County Public Health.
You know, it's an important conversation that sets the stage for everything to come in this season. So let's jump in. Take it away, Dr. Boerwinkle.
Hello, and thank you for listening. I'm Dr. Eric Boerwinkle, Dean of the UTHealth Houston School of Public Health, and I'm pleased to offer this special introduction to the second season of the Action Lab podcast, Beyond Boundaries. Our institution covers such a broad spectrum of public health sciences and practice. Following a statewide convening of multiple stakeholders, we decided to focus this season on a single theme that I think will resonate with everyone: maternal and child health, a topic that affects individuals, families, communities, the economy, and the overall function of societies in Texas and around the world. Maternal and child health encompasses the physical and mental health of a pregnant person during pregnancy, childbirth, and the postpartum period, as well as the health of infants and children. Its importance cannot be overstated, as these two areas are foundational to the continuity of communities, influencing immediate and long-term outcomes for families and societies. First, let's explore the experience and state of maternal health. Every day, countless women navigate the challenges and joys of pregnancy and childbirth, an experience accompanied by a broad range of changes affecting the mother's physical and mental state. Across the globe and for all human existence, women often face serious health risks caused by pregnancy and childbirth. Here in the United States, an alarming statistic by the CDC reports a maternal mortality rate of nearly 19 women per 100,000. At the time of this recording, the most recent data shows that in the United States, 669 mothers died during childbirth in 2023. Frankly, our aspirational target should be 0. While the mortality rate has decreased nationally over the past few years, more work still needs to be done. These fatalities are often exacerbated by inadequate healthcare access and socioeconomic factors impacting health. I would be remiss not to acknowledge that these rates dramatically worsen for Black non-Hispanic women. The same 2023 report shows the maternal mortality rate for Black women was 50.3 deaths per 100,000 live births, a significantly higher rate compared to whites at 14.5, Hispanics at about 12.5, and Asians around 11 women. Additionally, many other public health issues affect mothers and their babies across the nation and globally every day. For example, the NIH reports that perinatal depression affects approximately 1 in 7 people during pregnancy or within the first year after childbirth. Unfortunately, 40% of individuals with a lifetime drug use disorder are women who are at the highest risk for substance abuse disorders during their reproductive years. The role of public health prevention and intervention practices can help improve these numbers and address and tackle so many of the other challenges pregnant persons face. Turning our attention to child health, we see that the early years of child's life are critical. It is a time of rapid growth and development that lays the foundation for their future health, learning, and success in life. Addressing early child health involves immediate medical care and access to nutrition, safe environments, and education about health practices. When we invest in children's health and wellness, we invest in the potential of our future leaders, innovators, and caregivers. Ensuring the health of pregnant persons is crucial, not only for their well-being, but also for the children's health itself. Healthy pregnancies lead to healthy babies, establishing a positive cycle that benefits future generations. Here at the UTHealth Houston School of Public Health, we are proud to be the home of the Michael and Susan Dell Center for Healthy Living, whose vision remains rooted in supporting healthy children to create a healthy world. Additionally, we have approximately 40 faculty members across all 5 departments passionately searching and contributing to improving maternal and child health outcomes. This includes groundbreaking work in postpartum depression, the role of our faculty in child development, and maternal and child undernutrition, health access policy work, and numerous community-based initiatives and public health interventions. I know that this season's podcast theme will rely heavily on those faculty's expertise in maternal and child health development. Maternal and child health is much more than mortality rates and medical care. Comprehensive public health strategies can improve mothers' and children's quality of life. When women receive adequate prenatal care, support during labor, and postpartum follow-up, they are more likely to experience positive outcomes, including lower rates of maternal depression and improved family dynamics. Similarly, when children have access to standard and proven routine medical care, nutritious foods, and educational opportunities, they are more likely to reach their full potential. Well-designed programs supporting women's and children's health and wellness can have seismic effects impacting societies worldwide. I cannot overlook the interconnectedness of maternal and child health with broader public health initiatives. Policies and programs that provide resources, tools, support, and education to empower pregnant persons and their families are essential to improving health outcomes. Family planning initiatives and maternal care programs can help break systemic cycles, creating ripple effects that benefit communities. Health systems that prioritize maternal and child health not only save lives, but enhance community resilience and economic development. I'm sure you can see why we've collaborated to focus an entire season of this podcast on this crucial topic. In this first episode, Drs. Baker and Hammerberg will kick off the season by speaking with experts in the field who will share insights into the state of maternal and child health, including challenges and successes of maternal and child health programs and actionable strategies for improvement, setting the stage for the rest of the season. As we embark on this important conversation this season, I invite you to reflect on maternal and child health status in your community. What changes can be made to better support the health and well-being of mothers and their children around you and in your community? How can you get involved? How can you raise awareness or advocate for those in need? Let's dive into the inspiring topic of maternal and child health and discover together how we can contribute to our school's vision of health without boundaries. creating a healthier, brighter future for communities everywhere.
Many thanks to Dr. Boerwinkle for that important message and season opener. Next, for our Alumni and Action segment, Jithan and I are joined by Larianna Vernado with Harris County Public Health. Larianna, thank you so much for joining us. We're so excited to have you. Welcome to the podcast.
Yes.
We like to start off every segment asking our guests to tell us a little bit about their journey within the field of public health. So, how did you find your way into public health and the maternal child health space? And did you choose public health or did public health choose you?
My experiences were very unique. So I'm from New Orleans, Louisiana. I attended Xavier University of Louisiana. And I remember graduating and my first choice was med school. And then my colleagues, my mentors, and everyone suggested that I do a master's program and take some time off because I had just went through a lot of personal things during my undergraduate career. And I remember getting a phone call from one of my colleagues and said, hey, we have a research experience at Baylor College of Medicine in Houston that we think would fit into, the picture. So I relocated to Houston, and what came out of that research experience was an AmeriCorps opportunity. So I served 2 terms in AmeriCorps, the first public health AmeriCorps at Legacy Community Health, which is FQHC in Houston. And during that time, I really found myself grounded into the public health space and being in the community and of the community. I knew that if I truly wanted to make a difference, I had to have boots on the ground in the community. And so that's kind of where public health started for me, the opportunity that came with AmeriCorps. AmeriCorps also funded my master's degree at UTHealth.
That's awesome.
And I was also able to complete the maternal child health certificate as well. So my research experience, which initially started in around migrant mothers coming into Texas Health Center and receiving care and delivering versus their a lot of them were of African backgrounds. Healthcare looks different in Africa versus it does in the US. And so we were looking at a lot of the comorbidities that they were experiencing and how that affected their health and birth outcomes in the US. Because a lot of pregnancy and just postpartum and even delivery care in the African, countries happens in the homes, with midwives and doulas, say so, versus here, a lot of it happens in the hospital systems. And so we were looking at kind of that piece from a U.S. health center, health system perspective. And that is kind of where my research started. Now my research has evolved because maternal child is so large, but I have a very unique opportunity to go into the space of advocacy, of access to care, of looking at just the landscape of Harris County in itself and how large it is, the largest county in Texas. But then also my research focus and area now is around maternal mortality and morbidity. As you may be aware, we have the highest rates of maternal mortality and morbidity in Harris County within the state of Texas and the 3rd highest within the U.S. And so currently looking at those risk factors and those community elements as it pertains to social determinants of health. And so when I say, I remember going down a rabbit hole when I wanted to see what was my research focus. And I literally wrote down MCH on a paper and I brought it over to Dr. Markham's office. And I was like, I don't know what I want to study. I was like, it's so much that I'm interested in because at some point we truly have to get down to the bottom of maternal mortality and morbidity in Harris County and in the state of Texas and across the U.S.
Tell us a little bit more too about the programs that you're overseeing at Harris County Public Health and, what are you seeing in the community?
Yes. So the program that I oversee at Harris County Public Health is the Maternal Child Program. And that was the very first program within Harris County Public Health. And so this program was built essentially to provide a level of service navigation and access to care for families to become self-sufficient. Mm-hmm. And so self-sufficiency looks different for all of our families. Another part of our program was ensuring that we meet them where they are. And what I mean by that is Harris County is huge. It's, I mean, you look at the 4 precincts and sometimes it can take you an hour to 2 hours to get to another place. Yeah. But when we begin to learn the landscape of Harris County, and I'm going to put it on my epidemiology hat right now because that's what my master's is in. We looked at what was those high-risk areas of maternal mortality and infant mortality. You know, as the saying goes, like, you know, if there's a healthy pregnancy, there's a healthy baby. If we don't have a healthy pregnancy, 9 times out of 10, we're not going to have a healthy baby. And so we started to look at the map of Harris County and see where those high-risk areas were that we wanted to put a lot of our focus of outreach in, being boots on the ground, building relationships with a lot of the community-based organizations, the churches, the schools, to see truly how can we impact those families, what are their needs? We can talk about medical needs all we want, but when we talk about the social determinants of health and their access to care, their access to transportation, their access to healthy foods, in some of these areas, it is truly a food desert. Mm-hmm. Or a food swamp, should I say, where there is only fast foods on the corners. Yeah. There's not a local H-E-B or a Kroger where they can shop and get healthy foods. And so a lot of what we do at Harris County Public Health is we're a home visitation program. So our direct service staff, which are essentially CHWs, community health workers, they go out into the homes, they assess the participants, but we also do this from a family unit. So not only is the pregnant woman or, you know, the postpartum woman is receiving our services, it's from a family perspective. You know, as they say, it takes a village to raise a child. So we want to make sure that we're inclusive of fathers, that we're inclusive of anyone that is in that home, supporting that mom through her pregnancy, through postpartum. And so that's why we wanted to reduce a lot of the barriers also as it pertains to the eligibility of our program. So there's only 2, and that is that they are a Harris County resident, so that they live in a Harris County zip code. And then secondly, that they are currently pregnant, recently delivered in the last 12 months, or experience a pregnancy loss in the last 12 months. And that last point is really, really important because a lot of what moms deal with, especially in the postpartum phase, or even when they experience that pregnancy loss, is they think that help is no longer there. You know, it's beyond the mental aspect of losing a baby. And so that actually blossomed our maternal mental health program at Harris County, which provides access to services internally where we don't have to jump through hoops, we don't have to go through the red tape to refer them out to behavioral health services, which can essentially in Harris County be 6 months out because there's not enough providers.
Wow. So how does somebody that fits in that eligibility criteria get information, or how do they get connected with the programs and services that you oversee?
Yes. So the good thing is, as I said, we're very boots on the ground. So we're in the communities. We're attending all of the community events on the weekends so that they can see who we are and build that rapport and that trust. But secondly, we do have a hotline, actually, and that is 713-368-MOMS. And so they can call the hotline. They can receive information. We can do same-day enrollment. We can even do same-day visit, where we go out and assess the situation. And then also they can reach us by email. We have websites. Most recently, we have a campaign that was released in January where we have commercials now. So we have billboards around the city. We truly put some thought into how we wanted to outreach to the community and kind of meet them where they are.
So I just want to ask, based on the current situation, the state of mental health in Texas, do you think there are key areas that need more attention?
Absolutely. I think that there are key areas that need attention. We're in a very hot seat right now around maternal and child health in the state of Texas. So I talk about that big win and, you know, having that access to Medicaid. But that's not going to fix it all. Right. So one thing that I truly advocate for is access to doulas during pregnancy and postpartum. We know that doulas have a true benefit. There is research, there's evidence that doulas can truly make a difference in birth and health outcomes for pregnant women in the state of Texas. The problem is that there's not enough funding around doula care. Doulas can be expensive, and also access to doulas as well. There's not enough to cover, you know, the millions of births that we have in Harris County, but then also across the state of Texas. One entity that I say that does a really, really great job is March of Dimes. That's one of our great partners. We work a lot with them. They kind of give us the data and we work with it. They also have a doula program where they train doulas, but then put them into the workforce and then give them the participants or the patients within Harris County. They do it on a cohort basis. So I can say that they are finding their foot in trying to advocate for pregnant moms, advocate for doula care, because it truly makes a difference in the experience of pregnancy. And then also within Harris County Public Health, something that came out of it, which was very beautiful, was our Maternal Health Bill of Rights. And so our Maternal Health Bill of Rights is empowering families, inclusive of fathers, of knowing what their rights are when they step into the hospital. When it's time to give birth, what questions do you truly ask? You know, how do you find that place of comfort knowing that mom and baby is going to make it out of this hospital alive? You know, what questions should you ask? When should you be concerned when things aren't going right? You know, and so we built that Maternal Health Bill of Rights to ensure that they feel empowered, that they have, it's literally like a little Z card that they can stick in their pockets on their way out the door and say, I know the questions that I need to ask. I want to feel empowered. I want to be involved in the care of, you know, the pregnant mom or, you know, as far as the dad, you know, sometimes they get left out and they're just sitting in the corner just waiting, you know, to be acknowledged. But we want to make sure that they are acknowledged from a family perspective.
That's an amazing resource and tool. How does somebody get a hold of the physical copy of that?
Yes. So you can request the physical copies. You can email us. You can call our hotline. We have posters that can go up into healthcare centers or hospital systems. We have the Z cards, and they come in about 10 languages. Wow. So yeah, we wanted to make sure that we, you know, meet the needs, especially because with Houston and Harris County being very diverse, you know, English is not the only language here. And that's another big factor in our program is ensuring that we had access to the language line, but we also have bilingual staff. Right. So if you call our hotline, you will reach someone. I monitor the hotline on the weekends as well. So yeah, it almost feels like I'm never off, but there's beauty in that. You know, there's truly beauty in that. One story that I can even tell about the beauty of that is there was a situation that happened where a mom was found by the sheriff's office sleeping outside of a church in Harris County. She was pregnant and she also had an infant child in the car. Very well, this was a case of, you know, Child Protective Services. Instead, the officer called us and said, hey, this is the situation. How can you help? Wow. I immediately called one of my staff. We have also social workers on our team, and we were able to get them into Starve Hope, which is a transitional housing, temporary housing for families. And what came out of that is the mom being at Starve Hope and enrolling in their program, but also we're able to visit Starve Hope and do the programming for us to assess her needs, to assess, you know, what is it that she truly needs to become self-sufficient. And that, like I said, that could have been easily a case of, you know, CPS, you know, and granted, we are mandated reporters. But what I find in the state of Texas is families are struggling. They are struggling beyond their even desires or wants of what they want out of life because jobs are hard to come by, or a job where it's paying the bills. We see a lot of our families that are experiencing homelessness during these trying times, and then, you're trying to access care, you're trying to take care of a baby, you're trying to keep food on the table, you're trying to go to work, and then childcare, it's almost like there's never an opportunity, or should I say a sufficient opportunity where they can check off all their boxes. Right. And so that's what we're helping them do.
Seems like there's so many different ways or areas with which maternal child health is impacted as well as can be impacted. So with all of that going on, like, what excites you the most about the work that you're doing? Like, what keeps you hopeful, and what are you looking forward to?
One being AmeriCorps. I am an advocate of AmeriCorps because it truly allows entry-level students to get into public health spaces. But two is reach out to your local health department. At Harris County Public Health, we do allow interns to come into our programs and learn and study, complete their practicum experiences. And so call the hotline if you want to come into maternal child health, and I promise one of my staff will be like, Larianna, this phone call is for you. Yeah. Or leave a voicemail.
Or call on the weekends.
Yes, or call on the weekends. I'm going to get the voicemail anyway. And so I'm truly honored to provide that space to students, as I said, because at one point, like I said, we're going to have to pass that baton.
Yeah. Wow. And even those that are interested in doing research in the area, right?
Even with research in the area, and don't be afraid to start at the entry level. Yeah. You can learn a lot at the entry level of even like a CHW. A lot of them are in the maternal and child health spaces just because of the need around Harris County for assistance and access to care. So a lot of the local FQHCs. So don't be afraid to knock on doors. Don't be afraid to knock down doors, because there's a space for all of us, and there's so much work to be done that we can't do it alone. We can't work in silos. We need the students, we need the interns, so that we can build them into a leadership position.
Great advice, and thank you for all you're doing.
Yes.
Obviously, you don't need us to tell you how impactful the work that you are doing is for the community, for Harris County, for the state of Texas, and for moms and babies everywhere. So thanks for coming on the podcast. We truly appreciate it.
Yes, thank you all so much. It's truly my honor.
Well, that wraps up first episode of season 2. We hope today's conversation helped frame the current landscape of maternal child health in Texas.
We have so much more to explore this season: mental health, nutrition, reproductive health, the critical role of caregivers. We'll be hearing from experts and advocates working on the front lines of these issues.
Make sure you stay subscribed so you don't miss an episode. And as always, we want to hear from you. Engage with us, share your thoughts, and be a part of the conversation.
Thanks for joining us on Beyond Boundaries. Until next time, stay curious, stay engaged, and keep pushing beyond boundaries.